pathology area of the thyroid gland or of the parathyroid gland. So this is one aspect. Another aspect is the swelling which moves with declutation. In that aspect again you have to keep these things in mind. Either it can be a subthyroid bursitis, maybe an ectopic thyroid, maybe some other thyroid swellings, thyroglossal ductal cyst, laryngocele or some kind of lymph node pretracheal which is fixed to trachea. So mixing up these 2 points, a midline swelling which moves up with declutation, we come to 4 common things. Either it can be something thyroid or a thyroglossal cyst or a laryngocele or a lymph nodes. Basically, if we distinguish or make a DD of these 4 things, thyroid pathology presentation will not have a movement during protrusion of tongue, though it will be moving with declutation, but it will not have a protrusion during the tongue movement. Lymph nodes generally will be of a very solid nature, it will not be of cystic nature, and definitely it will have some kind of history. The leftover 2 things which are very much similar to each other in many aspects, that is thyroglossal cyst and laryngocele. Both of them generally have a congenital presentation. Both of them generally have a midline presentation around the neck. Both of them have protrusion during declutation as well as during protrusion of the tongue. So what is the ultimate thing you need to get sure of? Do any VSG or any kind of radiological investigation? Okay. So this is the starting. I'll be going into the case proper. This is again not the picture of the patient because when the patient came for the first time I didn't take any pic of the patient. So this is just a pic taken from the internet. So thyroglossal cyst is the most common type of development cyst occurring always or near the midline at the level of the thyroid and cricoid cartilages. This is little bit regarding the embryology which you can get over any books or internet. I'm not going through it. The swelling moves up during swallowing and when the tongue is protruded, it usually painless, cystic, mobile and fluctuant. Diagnosis is made from history and a careful neck and a physical examination. Confirmation can be imaging techniques such as USG and CT of the neck, and as I said in the beginning, the gold standard for treatment is surgery, that is cyst and procedure. The case report, the second point which was there in my focus slide, the presentation, age presentation. The patient which came to me was not a child because if you see the literature again, you will find this cyst can occur at any time in the life, but it is more common in the early childhood. But my patient was a lady of 66 years of age. He had this history of swelling in the anterior part of the neck along the midline. It was painless and not increasing in size. There was no throat pain, only at times there appears a sensation of something lodged in the throat, which seems to create an obstruction during swallowing. She went to Apollo Hospital, Kolkata, where USG was advised to her. The report is there in there, but I'm reading it first. This is the report, and it was showing a thyroglossal cyst of size 1.46 centimeter into 9.97 centimeter, bilocular, containing clear fluid in the midline in front of the hyoid bone. Right lobe of the thyroid is larger than left, but both are within normal limits. The rest is normal, I'm not going through it. Doctors at that time, as I said, the modern procedure will be surgery, and they did it, they advised her surgery. And just to avoid surgery, she came for homeopathic treatment. This was the report. I took the case taking. I'm just going through it quickly. Patient has a history of hemorrhoids since her first childbirth 40 years ago. Now there is no complaint of bleeding or pain, but the pathology is still there. She is also suffering from arthritis due to which steroid was administered by doctors 5 years ago. Probably as a side effect of this, she was having hirsutism features on her face. Next, a family history was he was suffering from hypertension and grandfather was suffering from hypertension. Grandfather died of bronchial asthma. Patient is basically a housewife, but is belonging to a well-established family of advocates. Regarding the generals, the physical generals, the appetite was good and she cannot remain in empty stomach for a prolonged period. That makes her weak and he feels that she might faint. Chronic irritations occurring always after intake of spicy foods. Sensation of distension occurring all over the abdomen after dinner, desire for cold drinks. Although patient cannot tolerate winter months, but generally has an aggravation from taking anything cold. Bowel movements are irregular with insufficient and incomplete feeling. Profuse sweating occurs especially at night during sleep. Patient is very much forgetful. Regarding the mental generals, patient is very much forgetful, wants to do things in a hurried manner and was speaking quickly as well. Local and systemic examination, we find all over the skin we find red moles, and tongue was having a white coating over the entire surface. So this was the repatriation, and if you just see the rubrics, I started with the mental and then the general rubrics. you will find there are many rubrics. There are 14 rubrics which was taken, out of which the prescription which came out was Thuja, covered 12 symptoms. But one interesting thing again I want to focus on, which I highlighted earlier on, that the importance of repetidation. Thuja, actually, if you go through the chart, you will see covered none of the symptoms in first grade. Thuja is there, definitely is there, and the highest is also marks is also procured by Thuja only. But Thuja was covering either the second grade or in third grade. This is what I want to focus, that you might appear, means if you take the mental things, it might appear that there are many important drugs. For forgetful, hurrying movements, you might think about lycopodium. For hasty speech, you might think about mercurius. But there are other many rubrics also. For emptiness of the stomach, some other important drugs might come in the first grade. But if you do the repetidation, ultimately it's the totality which matters, and ultimately it was Thuja which came, and it was prescribed in LM potency. The treatment started in January, and then it continued for 6 months. It was almost an every month follow-up, starting with 0/1. And at the end of 6 months, the last prescription was 0/9, and in USG was done on August. This was the report, and it was clearly mentioned that there was no abnormality detected. The last focus which I wanted to, second last focus which I wanted to make, that is the documentation. Proper documentation is a very weak point in homeopathic clinical practice. So it becomes very difficult to get proper recognition of success by homeopathy and in the modern world as well. So one of the reasons for presenting this case is also to show the imaging technique, which was USG, done from the same center and done by the same sonologist, which is very important because different sonologists have a different angle, and due to the difference in angle, the reports may be different. So it can be best utilized for documentation. And the last thing is regarding the discussion and conclusion, I want to focus that if you go through the homeopathic literature, you might appear that in many literature cases there has been mentioned that homeopathy disease that doesn't come within the province of manual surgery. Surgery can remove or palliate effects of anatomical excess, which might appear that homeopathy is basically to focus on natural and dynamic diseases. Even it is also mentioned removal of the tangible products of the disease, if it is too far advanced, should be relegated to surgery. But the question is, who is going to decide that which case is purely surgical and it requires innovation, or it can be treated conservatively with medicine? Problem is that the modern medicine practitioners who are hypnotized by the glamour of the surgery, a needful thing obviously, but vastly misused. Many times certain cases which are expected to be entirely surgical, as per the printed books, journals and articles, can be dealt with medicines alone and the lifestyle modifications also. The above mentioned case is just one such example. So always keep in mind, this is taken from literature only, those affections, alteration and ailments appearing on the external parts that do not arise from any external injury, or that have some slight external wound for their immediate exciting cause, are produced in quiet manner, and their sources lies in some internal malady.